Well, hello and welcome to another segment of Durham Celebrates Recovery. September is National Recovery Month, and it is a time to celebrate the fact that despite all the negative stereotypes and stigma, people with mental health and substance use disorders do recover. Millions of them recover and go on to lead purposeful lives and contribute to their communities. My name is Bob Thomas. I'm the chair of the Recovery Community of Durham, and we work to support recovery in Durham, North Carolina. I would also like to mention that we are posting all of these segments to our website, which is recoverycommunityofdurham.org. You can go under events and find all 4 of the segments. I also want to thank our sponsors, Alliance Health and Addiction Professionals of North Carolina, for their strong and consistent support for recovery. So in this session, we are looking at how the coronavirus pandemic has been affecting recovery and people's lives in general. At the same time, we have an opioid epidemic, which is still increasing in number of deaths. I heard a doctor from West Virginia who noted the increase in deaths, saying that COVID-19 was like a hurricane, and opioid overdose deaths was sort of like global warming, where it's real, it's happening, it's deadly, but it's not getting the focus and the airplay that COVID-19 is getting right now. On top of that, COVID-19 has laid bare and exacerbated many racial injustices that are affecting Black and brown people in terms of the number of infections that they have and the number of deaths as a percentage of the population. So in terms of whether it's housing, education, employment, healthcare, access to treatment, there are so many inequities now that are being looked at that need to be discussed. And along with that, we've got the calls for criminal justice reform and police reform and the Black Lives Matter movement. And that is one thing that has given me hope, is that I see people of all races, creeds, and colors marching. And being a child of the 60s, I know a movement when I see one. This is not a fad. It's not something that's going to go away. Unfortunately, we have a dysfunctional president and a dysfunctional Senate, so it's not likely that anything is going to change until January of next year. And so I guess my final message is to make sure you get out and vote with a capital D, with a capital D. I'd like to introduce the panel, and we'll start with Drew.
Yeah, hi, I'm Drew Dahl. I coordinate the Reconciliation and Reentry Ministry for the Religious Coalition of a Nonviolent Durham. Glad to be here.
Mr. McDonald.
Hi, my name is Donald McDonald. I'm a person thriving in sustained recovery from severe mental and substance use disorders. I'm a recovery activist and a behavioral health recovery consultant. And happy Recovery Month, Bob. Good to see you, man.
Thank you, thank you. I called on the North Carolina Ambassador for Recovery, because if you follow him on Twitter or Instagram, you know he's all over the state, and he has always been supportive of recovery. Ramona?
Hi, I'm Ramona Branch. I'm a member engagement specialist with Alliance Health, and it's nice to be here with you all today.
Dr. Loney?
My name is Dr. Loney. Can you hear me?
Yep.
Okay, my name is Dr. Loney. I'm the clinical director for CAPS. I'm glad to put a face to Ramona, and I get your email, so now I can hear you. Finally get a chance to meet people I just talk to over emails and things. Anyway, I'm the clinical director for CAPS, Clinical Addiction Professional Services, mental health, substance abuse, and others. I'm also one of the older members of recovery in this community. I have over 40 years, which makes me the old guy, I guess that's what you want to call me. I've been in this community for a lot of years, and just I'm also a minister. That's it. Thank you.
All right, David? Can you unmute?
Am I still muted?
Nope, you're doing fine.
Okay. So again, Dave Logan, I'm a member of the faith team, and I also work as a comfort living as a transitional housing, and I work as the house manager, I guess you could say. And so that's it.
All right, thank you so much. Wilbert?
Is that Pip?
We'll come back to you, Wilbert. Carlisle.
Okay.
Wilbert, you're up, you're up. Can you hear me?
Okay,
Can you introduce yourself?
who, me?
Yes, Wilbert.
Okay. Once again, my name is Wilbur Pipkin. I manage the Jubilee House. I'm a member of the board for the Coalition of Nonviolent. And I've been doing a lot of speaking in concern about affordable housing and people coming out of prison into society and haven't been prepared for it. Thank you.
Thank you, Carlisle.
Hey. Hi, I'm Carlisle Johnson. I'm a clinical psychologist and the director of Provider Network Strategic Initiatives at Alliance Health. And I work with our providers on setting up a network of care that is accessible, evidence-based, and recovery-oriented. And I've been working a lot with the funding we get from the state for expansion of opioid treatment.
Thank you, Carlisle. Regina.
I'm Regina Musa. I'm currently working at UNC Injury Prevention Research Center. We're building a peer-to-peer learning network over Central Appalachia encompassing 7 states. I'm also a person in recovery. I am a recovery advocate, and I'm a strong harm reductionist.
Thank you, Regina. And Elijah. Major Bazemore.
Good afternoon. I'm Major Bazemore. I'm with the Durham County Sheriff's Office Detention Service Division, and I'm happy to announce that I think one of my major projects over the last 2 years, MAT at the Durham County Detention Facility, and it's good to see all you guys here, and thank you so much for all of your external support. I definitely want to give a shout out to NAMI Durham today, and a shout out to Alliance, and especially Carlisle, who is definitely a man that supports everything he says out of his mouth, and I don't know what I would do without him. Thank you for having me here today.
So Carlisle, why don't you say a little more about that, because this is a new initiative for a detention facility.
Sure.
To provide medication-assisted treatment.
Right. So we began the conversation as part of the Durham Joins Together work group a couple of years ago, looking at what our priorities were for the community, and really wanted to see some effort with the criminal justice involved population to address substance use disorders better. One of the challenges that we really have everywhere in the country, I think you can't go anywhere in the country without finding this as a problem, is that if you go into a detention center and you are on a medication for treatment of an opioid use disorder, you are usually taken off your medication. And I think there's a groundswell of really a movement to ask the question, why are we treating this differently than a medical illness like diabetes or hypertension, et cetera? And there have been many lawsuits about this, and they've been prevailing. It's under the 8th Amendment and the Americans with Disabilities Act. They've been getting favorable rulings saying that, if I go into the detention center I still get to take my insulin. I get to still take my Prozac. I get to still take my heart medication. Why are you taking me off of my methadone and my Suboxone? So we started the project of putting MAT into the detention center, but with the plan of not just starting it, but getting people connected to care afterwards. So the first phase was to not stop people, not to take people off their medication if they were already on it. So that's been successful. We, and Major Bazemore can tell more about the successes there, but it's been a real partnership with the detention center, with Alliance, with UNC, Duke, Durham Public Health, and the state of North Carolina. It's really taken a village to get this working. And it's been, I think, a tremendous project. We're one of the first in the state, if not the first in the state, to be doing some of the things we're doing. And I really hope this becomes, I think it will become standard practice in the future. And we'll look back on this day and say, we can't believe we denied people access to effective health care back in 2020. And so the next phase is not just to continue people on medication, but to offer them a choice of buprenorphine, methadone, or naltrexone, or any of the medications for MAT within the detention center, and then connect them with peers into the community. And I also have to shout out to Major Bazemore. He's been a wonderful partner. And Sheriff Burkhead. This would not work without the sheriff's firm commitment to this. And so we have other detention centers in the state that would not allow a peer into the detention center. Many peers also can't pass the criminal records check. They will have charges on their record that would preclude them from coming in. In our situation, we will look at that because we want lived experience that will relate to the people who are in the detention center. So it's really, I think, an opportunity to change how things are done, certainly in Durham, but hopefully be a model for others in the state. Major Bazemore, you have thoughts?
Carlisle, you did a phenomenal job. I tell you, you can tell you've been at all the meetings or read a million emails. A quick update and just a quick overview. Mr. Thomas and team, thank you so much for having us again so we can talk about, I think it's significant that we continue to talk about this program at the detention facility. We're at a point in our society where we have to do a paradigm shift around thinking of how we run detention facilities. We have to help people be in a better position to be in a better position when they come out than they were when they came in. As Carlisle alluded to just a few seconds ago, September 2nd, 2019, we started phase 1 of a 2-phase project to get MAT implemented in the Durham County Detention Facility. I'm happy to announce as of today, we've had 70 participants, even in the midst of Corona. I've been told no more times than I can shake a stick at, but we've still been able to move forward, very, very slow, but we've been able to move forward with this program. To date, we've had 41 Suboxone participants, 29 methadone participants. We currently have 2 Suboxone participants in custody and 1 methadone participant. Our goal was to have phase 2 up and going where we would actually start induction. Because of Corona, we had to completely stop. Based on grant funding, I guess to be safe, we're gonna try to shoot for November to move into phase 2. We have 3 grants that we are working with. One is already in place that supplies us a external peer support, and that peer is doing a dual role, working with the FIT program, and they're gonna also be working with MAT externally. So people will be discharged and they will have somebody to connect with. We have a grant from the state, which Carlisle is helping us with. And with that grant, we're going to have a clinician that's embedded in the agency to help to help screen individuals and to start this induction process. And then finally, we're going to have another peer that's going to be embedded inside, that's going to kind of help with the face sheet, the networking, and get some of the contact information going. We're going to start interviewing for those positions the 1st of October. Hopefully we can have somebody on board by the 1st of November or the middle of October. That's the goal right now. That's pretty much a 35,000 foot overview of what's going, or what we've done to date in terms of getting this program up and going. We have about 45 people that's serving on this community, include Public Health, Alliance, UNC, Duke, BART, Durham Recovery Innovations. Who did I miss, Carlisle? CJRC.
State Opioid Treatment Authority.
State Opioid Treatment. Oh my goodness, they've been a blessing to us. They've been able to help us get some stuff in place. Finally, one other thing that Durham is, the sheriff has authorized us to get an OTP up and going. So we're in the initial stages of getting that up and going also. Again, we had hoped that would be in place by now. So we still have quite a few things that we're trying to accomplish before we slip out of 2020.
Thank you guys. So I'm wondering, in terms of Donald and Drew and Dr. Loney, are you seeing any initiatives that are, how has it affected your ability to interact with people in the community? Let's start with Dr. Loney.
Well, one, I just want to, tag on to Bazemore and the work that the detention center has been doing all along with the STAR program, and even now is just a beautiful thing. Knowing that so much is being done for the recovering community, starting out with the old school of drug addict, dope fiend, to a human being, people who are in need of services, and that's a beautiful thing. From going back, well, give me your question again, Bob. I was just enjoying what I was hearing. Just loved it, man. What was your question again? I'm sorry.
How the coronavirus has impacted your ability to provide services, because I know you work in some of the most underserved areas of the state.
Yeah, we do substance abuse and mental health, and we serve 5 county, Orange County, Alamance, Durham, a wide range of areas. And because of the pandemic, we had to go back down to using Zoom virtual technology. And when you get into some of the outlining areas, you have a population, Caswell County, where people don't have that technology knowledge, and a lot of people are reluctant and are hesitant to even try to get on Zoom and using some of the technology. And then some areas like Caswell and other areas, you can't even connect. So it's presenting a real challenge, and especially when people are early in recovery, there's already some barriers to come in to even get treatment with the stigmas and all the other stuff, and now you have to use this new technology, and so it's been trying, and the other thing is, with a lot of closing. People losing employment, and a lot of times people who are moving from active addiction into early addiction or early recovery. One of the biggest challenges is that they tend to be on the lower end of employment radar. They are the ones that are employed that are losing their jobs. So you get into areas where like, Alamance, and you get into Henderson, 5 County, and some of the other surrounding areas, Caswell County, where people are fearful of virtual technology, and losing of jobs, and it's still saying, get clean and sober for what? You know what I mean? There's so much disparity and those kind of things going on. It's really presented a real challenge to meet that population, and providing them with services. I mean, the biggest thing is, as I'm meeting new people, doing therapy with someone in front of you in your office or in your presence, you can get a feel that relationships grows. You can develop a real good relationship. But when you're doing counseling or therapy in someone's home and the baby's crying, it becomes a real challenge. You know what I mean? But the good news is, as we continue on, and I want to thank, not just Alliance and Cardinal and some of the things that the state is doing, is allowing agencies and providers like myself to become creative, to figure out how to get through this. This whole pandemic thing, it's about how to get through this. How do you make how do you make things work? And so slowly but surely, things are happening. We're developing, rearranging how we meet people, talk to people, and engage people, and becoming more comfortable with using technology. Just listening to some of the things, and I wasn't aware of all the things that were happening in the detention office. And so even now, we, with one of the programs we have at CAPS, we have a contract with the United States federal probation officers, where we're doing mental health and substance abuse with folks being released from the federal penitentiary. And so just listening to some of the challenges that are happening when people come out with opiate problems and those kind of things like that, and how to serve them, because again, the other thing is employment, and then training people, those things. But the good news is that this day and time, as we work through this, good things are happening. More so than it's just drying up and dying out. But I'm just enjoying what I'm hearing, and feeling kind of hopeful that we're going to continue this, and and just with Alliance and Cardinal and the other providers, and just listening to some other people here on board here, that there should be an uplift as we continue to work through this and serving people. Thank you.
Thank you, Dr. Loney. Yeah, so much of COVID-19 is antithetical to recovery, in that it says, isolate, social distance, quarantine. And people in recovery generally are much more used to face-to-face meetings, handshakes, and hugs. So, it's definitely changed the way that people meet. And I think Zoom and other platforms, is physically distant, but you can still get emotionally connected to people, and if they have the resources. But Donald, you want to jump in on this?
Sure, thanks. Yeah, one of the many contributing factors to substance use disorder is dislocation, isolation, and lack of purpose. And one of the protective factors or bits of recovery capital for initiating and sustaining recovery is the opposite of that. Being located and connected with other humans and finding purpose and direction in your life. What I'm most excited about is how the recovery community stepped up without missing a beat. We transitioned to digital recovery support services like that. This was a space that was already growing. We already recognized that it filled the gap for many people in rural and underserved communities, many folks who do not have transportation, folks who may be experiencing some emotional issues where connecting with other folks in meet space isn't really tenable. So it was growing slowly, and an unintended positive consequence of the pandemic is that it created a surge in that space. And it's been driven by our community. It hasn't been driven by the outside. And organizations like Recovery Community of Durham and Sunrise Community for Recovery and Wellness, Promise Resource Network, Wilson Substance Prevention Coalition's Recovery Community Concept Center have all transitioned to digital recovery support services. And I've participated in the mutual aid meetings. So you were speaking about AA and NA and stuff, and how we like to have coffee and hug on each other. These peer recovery mutual aid societies are available in a digital space now. And this is another unintended positive consequence of this. People in recovery are getting exposed to much more diversity and choice in this space. Bob, you know, we, as part of the recovery movement, we've been promoting, obviously, the presence of 12-step, but 12-step alternatives for people with special needs and unique interests, and to find meetings where people look like you and believe like you. And so what we're discovering is people, you know, you get a young woman in a rural community who gets to get online and be with people who look like her, whether it's a gender specific group or it's a secular group or LGBTQ plus group. So I'm excited about that. The digital space is here to stay, not going anywhere. So come get you some. But I'm hoping also when the dust settles, folks will have the wherewithal to create these alternatives and choice for people in physical space, because starting alternative mutual aid meetings is easy. I mean, y'all have done it. You're like, I want to start a refuge recovery meeting, Buddhist driven mutual aid meeting as an alternative to AA or NA. And you just, the resources are located on the website. You just start it and you do it. And so that's it. I'm really proud of the recovery community for driving the bus on this. And I hope no one swoops in and tries to colonize it.
So Donald, do you think there's any way back to where we were 6 months ago?
Absolutely.
Or do you think that telemedicine, teleconferencing is going to be maybe the primary way that people do catch up with a doctor or therapist?
Well, I believe, as did one of our thought leaders, William White, that we were slowly evolving into a space and a time where the majority of the interaction would be digital, and that's not necessarily a bad thing, because that's the way the whole culture we live in is evolving to more engagement digitally. So why not treatment and recovery support services as well? But I think we're not going to stay there. It's going to be a delightful blend of choice and option, and the reduction of obstacles for people to initiate and sustain recovery. We've created too many barriers for people to find freedom and wellness from mental and substance use disorders. And those barriers are often driven by stigmatizing assumptions about these behavioral health issues. So I'm excited about the future. Pandemic has brought some positive unintended consequence for our space.
So Zoom and other platforms are just another tool in the toolbox that people can use.
That's right.
Gives more options. Kyle, I had a question for you about, because we had discussed this a little bit in a prior meeting that, you know.
Robert, I hate to interrupt. Can I jump in here for a second?
Sure.
I want to respond to what I've been hearing the last couple of minutes. Digital conversation is great if you are on the right side of the digital divide. The vast majority of the partners we work with are people who have, you know, working with someone who has been in prison 15, 20, 25 years. is not unusual. We've had people coming home the last 6 weeks or 2 months now with the accelerated maps that we had a guy who went to prison in 1968 come home the end of August. So you have the challenge of being able to use the technology. And even if you can use the technology, our partners cannot afford unlimited data plans. And a Zoom call like the one we're on right now will eat up about half of your monthly data plan. So to say, oh, we have the ability to do stuff digitally, no, you don't. And even if you have the data plan and you're comfortable with the technology, many of our partners are living in congregate housing, where when you're trying to have conversations, you are around other people that you don't necessarily want to be telling your business around. So the concern I have with saying as well, we just ought to do more stuff digitally. That only works if you're wealthy enough to be able to do that. And you're confident enough in using technology. And there are a boatload of people in recovery who either aren't that comfortable with technology or don't have the funds to afford the nice cell phone and the data plan to be able to afford to do that context. And I'd like, if you don't mind, I'd like to hear from Dave and Pip, because they are actually, living in the midst of that issue. And I'd like to have some feedback from them.
David?
Okay. Hey, Bob. It's challenging as far as again, I'm a recovering addict, and I live in a transitional house, comfort transitional living, ran by Larry McGill. I manage one of the houses, and we actually take in folk who have some have just came out of jail, and some who are have other challenges. I will say that it's difficult for a lot of them. This is I think Don was saying, whomever it was, that they come out and they have no clue. I've got one guy, Mr. King, was in jail for 12 years and has no clue about technology and that sort of thing. So we try to help them out a little bit and also get them, different other services. It's a challenge. It's scary for me because a lot of, we get a lot of people kind of like off the street as well. And so, they're tested and stuff, but it's, that they go out and they work day jobs and they come back in, and it's, with the COVID thing, it's scary because, I don't know how safe people are being, for one thing. And I'm kind of rounding a little bit, but it's the fact that we are isolated now more so than we used to be with the COVID thing. It's been a challenge with me. One of the things that I used to do when I was using is when I was using, I isolated. So the COVID thing, it makes it difficult. Thankfully, I'm on the faith team, and they are a great support for me. As far as I know that it's not like I've had a few emotional setbacks, and I knew I could always call Drew, Aviva, Blair, whomever, and have a conversation and kind of talk it out. And it helps a great deal. But a lot of folks don't have that kind of support. So it's a challenge.
Thank you, David. Regina, I've been watching your facial expressions, and I think you really want to have something to say here.
I'm sorry about my face. I just got off of a 2-hour panel, so my apologies if my face is, and so everybody who knows me on this, and I'm so thankful for the people that I already know on this, and thank you for inviting me. Carlisle, thank you so much for all the work and always supporting me. And I love to see Bazemore and Donald. And so I'm in recovery as well, right? So I'm just going to speak from my experience and also from the work that I do and the work that I don't get paid to do, but still do, right? Which is direct services. So, so I'll tell you, when COVID first hit, COVID was like, I don't know if I took it so seriously. And I have family that lives in New Jersey, and we lost 5 family members in 1 month. And it didn't happen like, you know, so we lost a whole generation, and now I have these 3 kids, but it didn't hit North Carolina like that. So, you know, I was still like, well, you know, I went up there and I was like, hey, you guys want to go out to dinner? And everything was closed down, different feel. But because I knew what COVID was up there, you know, and how it affected us, I'll just speak to how it affected me. So initially I was like, I don't want to do these Zoom calls. This is just me talking about my recovery. I was like, I don't want to do Zoom calls. And this is with, you know, a couple years under my belt. And then in harm reduction, the work that we do, we teach people to never use alone, right? To always have Narcan, to always use with somebody else. I mean, we're not promoting, we're trying to actually, we do prevention work, right? Passing out safe syringes, giving out Narcan, safe sex supplies. And here comes something that tells people you cannot look on other people. And what I will tell you is that I think because of COVID, I think somebody touched on it earlier, how overpowering COVID is. I don't know if I've actually had the chance to grieve the losses of overdose, because this is the first thing since I've been in recovery that is larger than the opioid epidemic at this time. This COVID has taken over, and not just that, the racial injustice as well. So what I'm noticing is all these movements coming up, and I'm not saying that any of them are any less important. Everything is, but all it is, it's a lot more division, right? So here we go with this fractured already, and now there's more division and more division. And I don't want to go to AA anymore because I think people are racist, the same people that I helped. And this is me, right? As a professional that works in this field. And all I'll say is that COVID has done a number. I actually, I am on Zoom. What it did for my recovery, only because I had the capability, is I'm in the same meeting every morning at 9:30, but people I work with don't, they live off of Wi-Fi. So if they can connect to a McDonald's or something like that, these are people that are they may not be in chaotic use, but they're, you know, when they first opened the hotels for people with COVID, they called it the high risk hotel. Imagine how stigmatizing that is. So this is a place where we're supposed to help people get better, and then they changed the narrative, and now it's the healthy hotel. But I mean, it's just, COVID has done a number on the recovery. You know what I mean? What I'll tell you is that, first of all, I bought stock in Zoom, number one, because I don't think we're going anywhere, right? I don't think we're going anywhere. I don't foresee. I started a job that was supposed to travel 7 states, and everything is now condensed to digital. So we had to learn how to navigate. I think recovery is at an all-time high right now. I think I applaud the people that are coming through the door right now, and without, you know, trying to get sober right now. Anybody I see, I'm like, congratulations, whatever we can do to help, whatever I can do to help. But this is not only in recovery, but in life in general. Just watching everything that's going on is traumatic. So, you know, I applaud this platform. I'm sorry if it always looks like I have something to say. I normally do, and it makes a lot more sense. But I think what I do want to hit on is, like, we're all doing the best we can. You know, none of us, I don't know about y'all, but I was traveling 7 states, and we were gonna scale up nationally, right? Or, you know what I mean? This is region, we're in regions nationally. And like, all we're doing is the best we can right now. And I do agree with you, Drew. I think it's a very hard time. I'm also a resident manager at a sober living place. That's, you know what I mean? And everybody was home because of COVID. So it was very intense. And, you know, and I still don't want to have in-person meetings in my household, but at the same time, we're learning how to do this. If we turn into the Jetsons by the end of this, I will not be surprised at all. But anyway, that's about all I have to share. And thank you for allowing me to be here.
Thank you so much, Regina. Yeah, it's, I don't think anybody really knows how do you gauge how well you're doing in terms of your job performance when you have all these things to deal with and the anxiety that this COVID-19 brings? I mean, I definitely feel anxious all the time. I'm coming up on 70, and when I go out to the food store or whatever, I'm always worried about people around me. So I'm wondering what you guys do for your own self-care. How do you keep yourself well? How do you keep yourself with all the problems and all the questions and all the things that can go wrong? How do you keep yourself well during this time? Start with Carlisle.
Well, you're assuming I do keep myself well.
That's a good thing. That's a good thing.
You know, I'm actually trying to just have perspective. I think, yeah, I think often it's easy just to kind of get in your own bubble and think you're the only one suffering from something or the only one dealing with something, and just trying to understand how good we have it and what are the positives and what are the things, what are the silver linings of this that we can get. You know, counting the days to saying goodbye to this year. I'm gonna stay up to midnight to make sure the year goes out. And, but you know, I'm trying to find ways to connect to people and I think we have a lot of forces pushing us against our natural instincts to maintain a connection. And I think we talk about social distancing, but maybe the term should be physical distancing while we maintain a social connection and figuring out, like, I've resisted Facebook for about 20 years, and I just got into Facebook, and, you know, I'm trying everything I can to reconnect to people.
Okay, wonderful. Yeah, there's so much divisiveness out there now. It's just, it is definitely an unbelievable time. Mr. McDonald, how are you taking care of yourself?
You know, I work remotely from North Carolina, and with a lot of responsibilities, and the work will never be complete. So I put on my Outlook calendar a lunch break and an afternoon walk break for me and my dog. And I try to commit to those as much as possible. And during my lunch break, I'll watch a little Netflix. You know, even with all the chaos and the responsibilities, I'm like, nope, this is my time right here, right now. And I watch garbage and try not to eat garbage. My wife and I are trying to eat super healthy right now, and it's been fun doing that together. We have an empty nest for the first time in 25 years. Take lots of walks in the woods, and I have a partner too. And I love what Carlisle said, perspective, you know, because you know, I can isolate in a group and blow this up into, you know, I'm not just in recovery from substance use disorder. I'm in recovery from severe mental disorder as well. And this is a very triggering time for our people right now. And I have to stay connected with other folks and be honest about the profound fears that I'm experiencing right now. And the best advice that I've received is, it's okay not to be okay. And I'll just leave it at that. It's okay not to be okay. Come get you some love from somebody.
Thank you, Donald. Elijah, how about you? How are you taking care of yourself?
Thomas, actually, I have not been taking care of myself.
That's okay too.
Yeah. I'm actually in Myrtle Beach right now, and I literally worked every day since I've been down here. And I told Carlisle I thought it was important. This conversation is so sobering because we sit on one side of the table thinking what's best, what will work, what will help people. And then you hear a whole nother dynamic. You hear a whole nother perspective of what your thoughts and ideas may not be best for the individuals that are in need of these services. So, right, this has been, I normally try to take a couple of days off work. I normally try to take a week every other month. And this year, because of COVID, because of MAT, because of 5 million other projects we got going on at the agency, I haven't taken any time off. But this week has been very therapeutic. I got down here last Friday, and so we went out and bought bikes about a month ago. We finally found some bikes, and so I want to start bike riding. I want to do some other therapeutic things once I get out of the office in the afternoon.
Thank you, Major. Ramona, we haven't heard much from you. How are you doing in terms of self-care?
I'm doing well, thank you. It's been a struggle though. I mean, we've been I think we went home in March and we've been working from home ever since. So it's been really hard for me because I'm used to being out in the community so much and trying to find, that balance is very hard. So I have been like taking frequent breaks. I actually just recently moved my work area upstairs instead of downstairs. So I actually feel like when I go downstairs to eat lunch, I'm not at work anymore. Right? I'm away from my desk, and that has helped out because being like right there in Grand Central Station with my work right there, I've just felt like I was working all the time, and I mean it can be challenging. I mean, because I suffer from anxiety a lot, and this whole COVID thing has really played on my anxiety and just reading the news. I've actually stopped watching the news and I don't even look at the news app anymore. And I find myself not so depressed about what I'm reading. So that has helped out a lot and, connecting with friends. I miss going to the office every day and seeing people in there because there's nothing like that human connection. I really agree with what Drew was saying earlier about, one size doesn't fit all with the technology. It can reach a lot of people that are able, but I think in the end it needs to be a choice. If we can ever get to where we go to have choices like that again, because some people just don't do well building a rapport on Zoom. They need that interaction, so I think, I do think this is a wonderful thing for a lot of people, but I think we all need to add that to a choice. It needs to be a choice. So I really like everything that's going on with Carlisle and this opioid thing with the jail. I think that is wonderful. I used to do a lot of work with the STAR program when I worked in Task, and then I miss going out to the jail presenting to the STAR program about accessing services with Alliance. So I miss that because I think that's a really good thing too. So I'm really happy about a lot of good things that have happened because of something not so good.
Thank you, Ramona. Yeah, we're coming up on time, but Drew, let's hear what you're doing to help yourself.
Sorry. So boy, this is guilty pleasure time. I play Elder Scrolls Online, and I'm in a couple of guilds. And so when the day has become too long, I sign in, and there's always somebody online to go raid a dungeon with, and just kind of talk junk and have fun, laugh at each other. Last Friday night we just kept dying and dying and dying and dying, and it became funny at some point. So that's kind of the outlet, is just, even though they're not friends around me, they're people I've known for years in some cases, and we just kind of hang out and talk about how bad being stuck not seeing people is.
Yeah. Wonderful, wonderful. Dr. Loney.
Again, it's just a joy just to be here. I've just tried to discipline myself with certain things during the day to keep me focused, like getting up and I hate doing it every single morning. I hate it with a passion. Is making up my bed, and I make that up, and and I've been kind of health conscious, just trying to making sure I have a Conant bike here that I exercise on, and just trying to do a little exercising, trying to eat right. I've always been a workaholic, I guess you want to call it that. But the pandemic has cut a lot of that out. I've had a chance to sit back and watch a couple of movies and do some other stuff. I had a chance to go visit my mother in New York yesterday. I flew up Monday to see her. And I had a chance to spend a little time with my children. So I've just kind of, and again, doing some reading and some research, things that I kind of do. And the most important thing I've found that being able to go online to a lot of the Zoom meetings, I've been able to find some real meetings that I really enjoy, in Washington, D.C. and New York. So they come on at 8 o'clock and one at 9 o'clock. So I've been filling in the blanks and really just conscious of just, what's going on and talking to other people and, just utilizing the time more and more and more. And just try to be patient, man. This is some crazy times, man. But and just trying to stay focused, and praying and just doing those kind of things. Thank you.
Thank you, Steve. Yeah, I have to say that I have recently rediscovered Rice Krispie treats, and I've been eating a ton of them, but only on a certain day at a certain time, not like all day.
I don't know, Bob. That sounds like a confession.
My mother used to make them in a pan, and you pull them and cut them into slit. Well, now they have them in little packages, and you can just go buy those little packages.
Krispy Kreme has $5.99 dozens.
Stop!
Just in case anybody needed to know that.
We've got to have some guilty pleasures during this time. It's unbelievable.
They know what they're
No
doing.
Krispy Kreme. No Krispy Kreme. Just say no.
Yeah.
That
Okay. Anyway, thank you all for participating. Thank you all for being a part of National Recovery Month. And good luck, goodwill to all of you. Thank you so much.
Thank you for having us.
Thank you.
I have to grab a picture before we go.
Baseball, good talking to you.
Bye, Carlisle. It's always good to see you.
Bye, guys.
Dr. Loney, good seeing you, man. Good seeing all you guys. Y'all hang in there. Enjoy the rest of your day.
Better ride that
Thank
bike
you.
days more.
Thank all you guys. Nice meeting you. Nice meeting everybody.
Exactly. All right, we ready to go, y'all.
Bye.